The first talk will be by Dr. POOJA on orbital lymphoma, a case report.
A very good morning all, respected chairperson. Today I'll be presenting a case on orbital lymphoma. Myself Dr. POOJA, coming from Karnataka AIOC2023 Institute of Medical Sciences.
Can you load her presentation?
It's coming. It's not changing. Orbital lymphoma is one of the most common orbital tumors. It's a B-cell non-Hodgkin's lymphoma, and in most cases arises from the mucosa-associated lymphoid tissues. Contributes 2% of all lymphomas, 5 to 15% of all extranodal lymphomas, 50% of orbital malignancies, primary in adults. So the purpose of this study is to report a case of orbital lymphoma which was presented at a rural medical college. A 62-year-old male presented to us with severe proptosis with involvement of lids and adnexal region, lacrimal gland, cornea, conjunctiva with the Tenon's capsule. So on examination, there was a firm palpable mass in the fornical conjunctiva as well as the lids, and a salmon pink colored mass was seen in the conjunctiva bulbar area involving the cornea as well as the subtenons. We went ahead and performed MRI which showed iso to hypointense lesion extending from orbital apex up to the anterior orbit and encasement of the optic nerve and ocular muscles. So bits of tissues were taken from conjunctiva, palpable part of lacrimal gland, cornea, and was sent for histopathology. So on histopathology, it showed lymphoid cells arranged in sheets with prominent nucleoli. Further IHC was suggested and the patient was referred for the same to Kidwa Institute of Oncology at Bangalore. So patient underwent radiotherapy with significant improvement, mainly for cosmetic purpose, which showed reduction in proptosis. So no complications was observed at subsequent follow-ups post radiotherapy. The patient is being followed up for last 2 years. So you can, in the first photograph, you can notice the comparison between the pre and post radiotherapy with good systematic cosmetic appearance. No specific guidelines exist, but surgery combined with radiotherapy, chemotherapy has been seen in many cases. The difficulty of complete resection with preservation of function in the orbit may explain high relapse rate. Timely intervention in this case, supported by the histopathological diagnosis and radiotherapy, has improved patient's cosmesis in this case. We would like to thank Department of Pathology at AIOC2023 and Department of Radiotherapy and Pathology at Kidwa Institute of Oncology for timely diagnosis and helping us out in this case. On immunohistochemistry, it revealed low-grade indolent type of non-Hodgkin's lymphoma of extramarginal zone lymphoma. Yeah, these are my references. Thank you.
Thank you, doctor. It was a nice case. The change which radiotherapy has brought about is very phenomenal.
Yeah.
Did you mention about the visual acuity of the patient initially? Sorry, I missed the presentation.
Patient had no PL.
Did you mention that?
No.
Yeah, okay, fine. So actually the challenge is in diagnosing orbital lymphomas in the early stage, I think. So
Yeah,
at this
yeah,
stage, it
yeah.
is, we all think it will definitely be a
This
malignancy.
was during COVID time, so he
Yeah.
presented to us
Very late.
at a very later stage.
Okay, thank you very much.
Yeah.